Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. The Federal Ministry of Health and the National Agency for the Control of AIDS, that's NACA, with funding and technical support from the U.S. President's Emergency Plan for AIDS Relief, called PEPFAR, and other bodies, embarked on the Nigeria HIV/AIDS Indicator and Impact Survey on a national scale in 2018. This was a 6-month-long household-based survey to assess the prevalence of HIV and other health indicators. Respondents ranged from 0 to 64 years. Here with me to examine the facts and numbers is the Chief of Party of the Nigeria AIDS Indicator and Impact Survey, also the NICE project. His field of interest is epidemiology, public health, and infectious diseases. I'm here with Dr. Gambo Aliyu. You're welcome to the show, sir.
Thank you, Mary. Glad to be here with you.
Previous surveys have told us we have 3.2 million people living with HIV and AIDS. But this new survey tells us it's about 1.9 million, like
yes.
About half of that. What was different about this survey?
Okay. The difference is this survey is more representative. It doesn't mean the previous surveys were wrong.
Okay.
But the way we do this is, if you look at census, for instance, you go into every household, you count the number of individuals that are there. The number you come with at the end is the exact. That is what we call the population parameter.
Okay.
And that is the number you reference to whenever you make any estimate subsequently. When you do survey, what you do is you look at the census and you, something like shadow, take a sample. But in taking that sample, you make it representative in such a way that it touches everywhere. You're taking teensy tiny bit, but you are touching on every segment of the society. That's what we did. We touched on all the 774 LGAs in Nigeria, and we were a little bit larger this time around. Instead of taking small sample, the samples we took was relatively larger in size compared to previous surveys. So the estimates we are getting from this survey are more reliable, they are more robust, and they are more representative. Okay,
so, 1.9 million, it's good news. At least it's better news than what we've been hearing before, But was there anything that disappointed you about the survey? Any result that, you were taken aback at?
So, if you look at our fact sheet, one thing you see is when you look at the higher age group, and that is 30 and above, or 35 and above, you see the burden is higher in that age group. And the explanation could be either ways. Either these individuals are taking more risk compared to the younger age group, which I don't believe.
That would be odd,
Or, on the other side, which is very good, that people are now living longer with the disease.
Okay.
They are taking medication, and because they are taking medication, they are doing well on the medication. So when you come to survey, anytime you count them.
Okay.
So I think that is virtually what is happening, because...
So more people living with the disease than dying from the disease.
Okay, exactly. More people living with the disease because people are now more aware. They seek help. And obviously, for those that have the disease and they know they have the disease and they seek treatment or they are on treatment, they are doing very well.
Okay, I saw something that, surprised me a bit. Mm-hmm. Well, the first part wasn't such a surprise. It's the second part. The viral load seemed to be higher. The prevalence, let me put it that way, HIV prevalence, highest in the South-South. But the viral load suppression is lowest in the South-South. Why wouldn't people as enlightened as that be, more forward with their medication and, you know, tests and all that?
So this is very important, and it is showing us, if you look at the prevalence across the nation, you will see the northern states generally are low.
Are low,
the
yes.
lowest is the northwest, where you have an average of about 0.6, followed by the northeast, 1.1, then southwest, 1.2, and when you look at north central, you have a number of like 2.1.
2 point something, but south, 3 point something.
3 point something, and then southeast coming close to north central, 1.9. And what that shows is, you know, HIV has less to do with educational status, but it has more to do with individuals' behavior and the tendency of that person to take risk. Somebody may know about HIV, but are they willing, you know, to play safe? Okay. So that's the question. So what we are seeing is that this is raging more in the South, okay, and people are not doing well on treatment. Yeah, people are not doing well on treatment. Those who know they have the disease, you know, are not receiving treatment. So if they're not receiving treatment, and those that are receiving treatment are not suppressing the virus very well. When you suppress the virus, that's when you cut off transmission.
Okay, so there was this other statistic that was really good to see. The people 0 to 14 years, their prevalence is really low, 0.2. That is so good. I assume that's because there's been a lot of aggressive fight against mother-to-child transmission.
Right.
But you enlighten us, you're the expert.
Right. You're right. Multiple factors here. That age group, you know, are not considered sexually active. So you don't expect HIV to rage like the way you see it in the sexually active.
So no horizontal transmission,
right.
Little horizontal transmission for them.
Little horizontal transmission, more vertical transmission, but because of what has changed now in terms of vertical transmission, the number of Nigerian mothers, you know, giving HIV to their newborn baby has drastically reduced because of those programs that are in place in various places. Yeah, so that has contributed.
Okay, but then there's this other thing about 4 out of 5 women had at least one antenatal visit, but only 2 out of 5 knew their status. Isn't it, routine for a woman who goes to her antenatal visit to know her status these days?
Right, it's routine. It's routine and it's encouraged. But one thing about HIV test, as like any other test, you know, individuals are expected to consent. As a doctor, you need to seek their permission, or caregiver, inform them or notify them that you want to test them for this. And it's important they get the buy-in, and it's important they know the importance of knowing their status.
Okay, now that you have more widespread information about HIV in the country, perhaps more accurate numbers, what's changing about our response to HIV/AIDS infection in the country, our response to it?
Yeah, the response is changing because government with its supporters are now getting ready to make sure that where the infection is raging, a lot of attention is given. You're talking about South-South. So very soon you will see robust measures taken to aggressively encourage individuals to know their status. This is across the nation, but in terms of those areas where the issues are very critical, you know, more effort, more resources will be deployed. You'll see people testing more for HIV, a lot of people getting treatment and be retained in treatment. So this is the plan. From now up until the end of last year, government and its supporters are planning, when I say supporters, I mean PEPFAR in particular, are planning to add 500,000 individuals that were hitherto not on HIV treatment, probably do not even know their HIV status on treatment. Right now, we have about 1.1 million or just above 1 million
people on
individual
treatment.
people on treatment. And our estimation from the survey shows that we have close to about 1.9 or around 1.9 million people living with HIV. So you have a gap of about 700 individuals. So the goal is going forward from now until the end of 2020. There's a whole program now that is in place. It's called SURGE. And the goal is to make sure there is rapid increase in number of people who are knowing their status and are getting to take HIV treatment. And as I said earlier, Nigerians are doing very well, on HIV treatment. So once they know their status and they access care, they do very well on treatment. So once we got this number, it is very hopeful that the entire goal of what is needed to be achieved, going forward, given the nice result, which is epidemic control, is very, very much in sight.
Okay. Now, some countries, one country in particular, is reporting no deaths from HIV/AIDS infection in 2018. No deaths. And then there are two others that reported no new infection. That is phenomenal. Now, I want you to just tell us, can we make 2030? Can we be like this in 2030?
We can be. It all depends on,
That's 11 years to go?
11 years to go is very, very possible. The goal is get everyone that has HIV infection, or close to 90% of individuals that have the disease in them, to know they have. And get another 90% of those who know they have this infection in them to start treatment. And retain them in treatment, retain about 90% of those who have started treatment, to continue taking this medication. If you do that, it's very likely, you achieve what we call epidemic control. And what you're describing is epidemic control, which means the number of people that are getting new HIV infection way surpass the number of people dying from HIV. So when you have control, the reverse is the case. The number of people dying from the disease is actually higher, or the number of people getting new infection are less than the number of people dying from the disease. Yeah, so especially countries where the population is small, you have a country that has a population of 2 million people, or 3 million people, or 5 million people, and they have a universal care system where everybody is enrolled and they have a record on everyone. This is highly achievable. You will get to know the exact number, in that case, almost near the exact number, except individuals that come up to facility, to access care. But as long as individuals come to facility and access care, such tests will be offered and their status will be known. So it is highly achievable.
Were you able to link everybody you got in your survey who tested positive to care? Is the response that good?
The response is good. I can say in previous surveys of this kind, it has never been this level. We were able, from the time we start this survey up until last month, we linked 63%.
Okay, I'm going to have to pause you there.
Right.
We'll continue after the break. Please stay with us. We're coming back in a half a minute. Welcome back. You can ask your questions about HIV and AIDS and the NICE survey by calling 0808-054-2233. That's 0808-054-2233. You can also tweet at CTV_Mary A while we continue about response. So, because, it's kind of weird. Somebody suddenly finding out that he's positive or she's positive and didn't know before, even though it's a bit comforting to learn within the four walls of the house. So how was the response like to linking to treatment?
It's very encouraging. I mean, getting to link 60% of individuals, about 3,000 individuals that we identified with new HIV 1,800, let me see, with new HIV infection. Others that were identified during the survey, they knew their status. They were already receiving care, treatment at various facilities. So this is phenomenal. It takes time to link people to care, but to achieve this within a period of 6 months, is really great. We're looking forward to 100% in the next couple of months, and this will be by implementing partners, organizations that are providing HIV treatment and care services across the nation.
Do you have any plans, active, aggressive plans for Borno State and Zamfara State, which were not fully covered because of conflict?
Okay, they were not fully covered because of conflict, but we believe the number we have sampled, in Zamfara, I could remember we were in up to more than 50% of the enumeration areas that were selected for the survey. Likewise, in Borno, we have gone above 40%. So we believe the data we are getting are representative enough to tell us something about Borno State as well as Zamfara State. The numbers were not very high, the way we are seeing them.
Okay.
Yeah, and we believe those numbers, to greater extent represent
Let me
Borno
quickly
and Zamfara.
cut in there, sorry about that, and take a call from Ibrahim. Ibrahim, are you with us?
Yes, I'm with you, ma'am.
What's your question?
Yes, my own question, because of the time, some women, most of the cases we have, more especially in the north, women, they are facing so ideal result now. We don't know what is the next step about the ideal result, because more especially in the north, they are not going to the test before the marriage. And then, hello?
We can hear you. You said they don't do tests before they get married.
Yes, the major problem of the north. Secondly, we have a HIV-1. Are you with me? Okay, I will call you back again.
Go on. Okay, we lost him. Well, can you speak to that about people not getting tested before getting married?
So this is what we are saying. We are encouraging everyone, not only those that are getting married, but is something that is fundamentally unique or important for somebody to know where they stand with respect to HIV. Do I have it or I don't have it? If I don't have it, what do I do, to remain negative? Mm-hmm. If I have it, what do I do to make sure I live healthy life and I live long without any disturbance from HIV?
Okay, people in the research center, are talking about a new cocktail or a new plan of drugs that has been shown to reduce the copies to less than 50 so that there's no transmission. So based on this, first of all, you tell me if that's true, and then based on that, can somebody with this infection get married and actually not give their partner?
Okay. So it comes down to treatment, viral suppression, and maintaining individuals on treatment. Yes, it is possible, to get married, but this is supposed to be with a couple's consent.
Okay.
The individual knows that his or her spouse, is HIV positive and is willing, to go into that contractual relationship. That's fine. The next thing is to ensure, one, the individual remain on treatment and virally suppressed.
Okay, let's talk to Jude. Hello, Jude.
Yeah, good afternoon, madam.
Good afternoon, Jude. What's your question?
Yeah, my question is
Jude, if your TV is on, you need to put it off so that we can hear you well.
Yeah, my TV is muted.
Okay, what's your question? Go ahead.
Okay, if I discover my wife is, diagnosed with HIV positive, and I don't have it, and
Go ahead.
oh, okay, yeah, if a man and his wife have 2 children are partners, then the wife alone is HIV positive, what should the man do?
If his wife has it and he doesn't have it.
Yes, the wife has it, the 2 kids doesn't have it, and the husband too doesn't have it.
Okay.
So how do we help such situation?
All right. Thank you, Jude. That was a good one. A man is clean, negative. His wife has it, and they're having children. What do you advise?
Okay. The advice is the lady should access treatment if she hitherto is not on treatment, and that treatment has to be continuous. And the husband also should know that the risk of transmission, is much less, or even not there, when treatment is adhered to, but does not completely exclude it. Okay. So they need to get advice from their physicians or caregiver on how the husband will remain negative, and the wife will continue to take medication without their children being affected.
So her children will be free?
Yes.
And her husband he has a very small chance.
Right.
But there is that chance.
There is that chance. The chance is reduced, with adherence to medication and with safe sex practices. Okay. So these are things that they need to work out with their caregivers to advise them in case they want to go for additional kids. So there are advices that will be given by their caregivers that will be helpful.
Okay, let's take this call from Musa in Bayelsa. Hello, Musa.
Hello, good afternoon.
Hello. Good afternoon. What's your question?
Good afternoon, so from the doctor that is speaking. Hello?
Hello, we can hear you. Speak up. Okay. We lost Musa, and I think we're almost out of time. But we were talking about the people under viral suppression or who are virally suppressed. Your survey, in the NICE survey, they are less than half. Why do you think this is so?
So it's not they are less than half. What that shows is the people who know they have HIV and they are on treatment, 50% of them, the entire individuals that we tested for HIV, that were HIV, we found them HIV positive, and we look at the viral suppression, it was less than 50%. Okay. What that means is that the population level of viral suppression is lower than what is expected or what the goal, the achievable goal.
Okay, so you're aiming high.
We're aiming high, and we're aiming 73%. Okay. We are now at 43%. So what that means is more people, are out there with HIV and are spreading the HIV. They don't know they have the HIV, and them knowing they have HIV and getting treatment is very critical. And once they know that and they get on treatment, then our chance of achieving 73 or going close to that 73 now becomes very good and increases. So this is the goal now going forward.
And now treatment is very accessible. I have to thank you very much for coming to the show. We're out of time, but that was really good. And thank you so much for following and asking your questions. I want to wish you a wonderful rest of the day. I am Mary Alale Yusuf.